Welcome to the Nourish Child Podcast, a show about childhood nutrition, feeding kids, and dealing with the ups and downs of growing a healthy child. Here's your host, registered dietitian and childhood nutrition expert, Jill Castle.
Hey friends, what if the key to a healthier family and a thriving community was right there in our kitchens? Our guest today believes just that, and she's built an incredible organization to prove it. Join me as I explore the innovative world of FamilyCook Productions with its passionate founder, Lynn Fredericks, and discover how simple, hands-on learning can cultivate lifelong healthy habits and build stronger, healthier communities. Lynn is the founder of FamilyCook Productions, a nonprofit organization. She's championed the power of fresh, affordable food to improve health and bring people together. Since 1995, Lynn has created hands-on culinary nutrition programs that have impacted over 370,000 parents and children across the U.S. Her Train the Trainer model embeds these programs in schools, community centers, WIC clinics, and hospitals, driving sustainable, healthy behavior changes. She's also an award-winning author of Cooking Time is Family Time and Get Your Family Eating Right. Her work has been recognized for its sustained outcomes and impressive results, leading to FamilyCook Productions being selected as the New York State Public Health Association's 2017 Public Health Leadership Awardee. She has presented over 30 scientific abstracts and published over 24 peer-reviewed articles. So Lynn is a little fireball when it comes to nutrition education in the community, and I thoroughly enjoyed our conversation together. We talked about what nutrition education really means and how to deliver it so that it does impact long-term wellness. And she talks about how nutrition education in the community, particularly with children, can impact overall health in the community. And we talk about the barriers to education and what she thinks needs to be emphasized with nutrition and food education in order to create lasting behavior and health change. We have a great conversation. I hope you get a lot out of it. She has quite an organization dedicated to children and adults, so I hope you enjoy hearing her insights and her story of how she came to build this company. And she's a gem. So here you are, Lynn Fredericks. I hope you enjoy. Lynn Fredericks, welcome to the Nourish Child Podcast.
Thank you, Jill. I'm very excited to be here with you.
It's great to have you on the show. As we were talking before we hit the record button, I feel like I know your work. I've gotten your emails in the past. I'm excited to have you on the show. We're going to be talking about nutrition education, one of my favorite topics, and also community health. But before we dive into those questions, can you share with the audience how you got into this work and a little bit about yourself in your own words?
I'd be very happy to. I've been living and breathing some form of nutrition education for almost 30 years now. It's been a really long time. So it started out so accidentally. I was a food and wine writer and a restaurant consultant, married to a chef here in New York. And we had one child when we moved here, and we had another baby. And when the little one was 6-8 months, we were opening a restaurant. We had one restaurant in New York. We were opening a restaurant in West Hampton, and everything fell apart in the marriage. And suddenly I was single parent.
Oh.
And being a single parent with kids that age and no family around, and it was really, really hard. And because of the kind of work that I was doing, I was being invited out to dinner a lot. And now, my finances changed. I couldn't be out doing that all the time. I had little children, no one around to help. It was really challenging.
Mm-hmm.
And as the months went on, as this became a new part of my life, I just felt like all I was a slave to being a mother of two children, and that there was no time to just enjoy being the mother of two children. So the
Yeah.
idea of being a slave to all the responsibilities of different age children, that was really tough. I didn't expect that that would be my life. And then, so like not finding times to have fun with them. And then I had two sons. I was raised with two sisters. And my mother had a sister. My dad had no children. So they didn't understand boys, and I wasn't around any boys and no boy cousins. I had no clue what to do with these two little boys. And I will tell you, they wanted to rule me. They
Mhm.
wanted to be the one in charge.
Yeah.
So obviously that was not going to work. So I was exhausted every single day. And then when the youngest was about 20 months old, so he wasn't even two, he wasn't talking a lot because I think his brother could talk more. So the older one talked more at that age. He did a lot of whining and a lot of demanding of me. And we were in the kitchen trying to make dinner. He's latched onto my leg, needing something. And I thought I was going to explode. And I literally peeled him off my legs and lifted him up and said, Stefan, I have a job for you. And I really didn't know what I was thinking. I'm, doing while I'm thinking. I put him in the baby seat in the kitchen, attached to the table, those kind of seats. And like, here's some basil. Take this. I think it can't hurt him, right?
Right.
Take this. Take the leaves off, and he's doing whatever. And like the next night, it was like, snap some green beans. But what I discovered, which was so fascinating, is that then he was happy. And you could tell he was actually kind of proud and impressed. He's like, helping.
Yeah. Look what I did. Yes.
Right. So, that kept going. I could trying different things, making sure that I could find enough different tasks, exploring. Then I just felt like, how sad that I'm having this very lovely one-on-one time with one child, and the other one is like watching Power Rangers.
Yeah.
And I'm like, I don't like that. So he was, 8, 9 years old at that point. So I took him to the grocery store and said, pick out dinner for 3 days. So I didn't have to tell him then come into the kitchen with those ingredients, right? Now it wasn't about what he was doing with his little brother. Now it's like, ooh, what are we going to do with pork chops?
Yeah. Yeah. Yeah.
So that was the start. And as I shifted that, dynamic in my house from me feeling like a slave to two little boys to us having one time of the day that was growing in harmony, growing in sense of interconnectedness. And we were having some fun. And we were sitting down and made the meal sitting down part fun. Things started to change. And I thought, my God, I can't like just sit on this and enjoy it. I'm a food professional. I need to share this somehow with other families. So that was the journey that started FamilyCook Productions.
That was the germination. Wow,
Yeah.
that's a great starter story. So you've been doing this for a lot of years.
1995.
Wow.
A long time.
Yeah.
And, I didn't know it would be a nonprofit. That happened many years later. No one was doing this. Apparently, Alice was doing this in California. There was a woman, Antonia Demas, doing something up in Trumansburg, New York. And one other person, I can't think of her name right now, doing this in Arizona. And we were able to meet. But everybody was, having a little bit different approach. But, doing any of these kinds of things in New York City was not easy. But at the time, I saw it as an education enhancement that would help with nutrition. But I can tell you that over time, that I had to change my dream about that really quickly and focus on public health, which I was, learning about and happy to, because I could see this was money to be able to do this was not coming from education.
Yeah. Yeah.
From the education, world, like, no.
Yeah, our structure of schools and
that wasn't
universities
going to come from that. I mean, there was after school opportunities, right? But if you wanted to, do something in school time or even after school time, you had to think of it. I mean, because this was now we're talking in the early 2000s. We were very worried as a country we began very worried about childhood obesity. So, that was the only place that I could see that I could find the support to be able to bring this. And then we moved from working in the classroom during the day and doing it ourselves. We did that for many years till around 2003. I had a real crossroads. My first cookbook had come out, Cooking Time is Family Time. And I'm like, all right, where is this headed? And I thought, if I really, I knew I could see from traveling around the country with the cookbook that the classes and the way these were organized, whether it was parents and kids or just kids, they were effective. But how do you grow this? The idea of using the arts model and having all these teachers that I would, fan out, like as a single parent, just being in charge of my children was enough. Having all these employees, that was not happening.
Yeah.
So I'm thinking about this and like, how is this going to work? And then I thought, well, why don't I train teachers, charge a little license, and then it's going to stick around because, you've invested in training and everything, and you don't have to keep waiting for, money to bring it back to this school, right?
Yeah. Yeah.
So that was, and we started doing that actually in Rochester, New York with YMCAs.
Great.
So yeah, so that's
so you've
how
been doing this for
the
a
model.
long time. Yeah. So, and you have FamilyCook Productions, which is a nonprofit organization, and you do that train the trainer model. I'll go through all of this. Well, you've heard all of this as a listener in Lynn's introduction, but what you might not know is you've presented over 30 scientific abstracts and published over 24 peer-reviewed articles. I'm not sure where you found the time to do that, but
Well,
you are.
students help. I was
Yes.
like a thesis mentor to a lot of students. Students help.
Yeah.
But I'm so glad you bring that up, Jill, because most people, if they were starting an organization like this, they might just be thinking about, especially when you get to the nonprofit stage, like, how do I grow this thing? How do I make it, and how do I make it this bigger, sustaining organization? Of course, I wanted to be sustaining, but it was so important to me from the very beginning that we were actually creating change, like behaviors were changing. I was never interested even before. I mean, I think the public health lens, as I got into that, really helped, but I was never interested in being, I am Lynn Fredericks of FamilyCook Productions, this nonprofit. That wasn't what was exciting to me. What was exciting to me was I have been able to unlock the, keys to supporting people to happily change, easily change. When I say easily, like on their own, not, having to drum things into their head, right? So naturally change their behavior around food so happily, so willingly. And I learned how to do that after, 6 or 7 years working in schools and with people of all ages. And nobody is really, people are struggling with this. So I want to disseminate it. I want to get it out there. So I had to do studies to be able to, to learn myself and then to share so that it was more generalizable, more people were. And then after 20 years, Jill, I was so frustrated as this work started going into clinical settings because I was watching highly educated people take these concepts of everything they learned about diabetes or whatever, and think that the community classes would be downloading that information to the people. And they don't want to know all of that before they cook dinner. They just want to know how to cook dinner and what kinds of foods are going to taste good and go together and are going to, not, aggravate their diabetes or their hypertension. That's all they want to know. They want to know.
So how do you incorporate nutrition education? So listeners out there are mostly parents and some professionals. But how are you integrating nutrition education into cooking? And you said secrets, or I in my head thought, oh, what are the secrets? But you said easy behavioral changes. What are the secrets to getting those?
So after 20 years, I asked myself that question. I'm like, how can I codify this? And I did a inventory of all our programs, and I looked at the different components of what experiences they offered. So we offer, palate development. We offer skill development with cooking. We offer an opportunity to take it from the classroom to the home. So you've extended to the home now. We're not just containing it in the classroom. And I came up with about 10 or 12 things. And I called them at the time drivers of behavior change because they were experiential drivers. They weren't things you told people. They were things that people experienced.
Okay.
But of course, we had to, facilitate the experience.
Mm-hmm.
So I found those together, and I got with my longtime colleague, Pam Cook from Teachers College, and from their program in nutrition. And I said, will you help me work on a study to be able to see if these 10 things are a real thing, and help me find a bunch of teachers that we could study this with and produce some research, because I'm convinced these are real. And I want to be able to publish it because I'm so tired of watching people approach this in a way that's not getting to those things that actually, from all these years of learning of what people have told us, influence their behavior to change.
Sure.
So we did this study. It came out in 2020, and it's called Experiential Features, a framework for 10 experiential drivers of behavior change. So, I can share that.
Can you give us?
Yes,
can
and
you
I'll
give
tell you
us a
what they are.
sense of what those drivers are?
I'll tell you what they are. So they're the same for young children and their parents as for adolescents and adults, but the dynamic and the way they're designed in the diagram is different. But essentially, overarching, they are challenge, success, and celebration. So the idea that you've got to challenge people, whether it's their palates or when they're, learning the skills of cooking, there's got to be some challenge there. You have to push people out of their comfort zone. Celebration. I mean, I don't know about you, but if I'm going to go to any kind of a class, I want to enjoy it. I want it to be fun. It has to be celebratory and feel good. And then cooking is not hard, but you also want a sense that you accomplished something, right?
Sure.
So if you're a 3-year-old and you cut the cucumber in half, the slice of cucumber in half, I did it. You're excited, right? Or if you're a high school student, you've just sliced an entire cucumber, you're feeling accomplished, right? And then you've made a meal and you can eat it, right? You're feeling accomplished. Then there's palate development. You have an opportunity to try new things. There's skill development, obviously, in the cooking. But another one, people don't think about this, skill reinforcement. If you do a demo only, Jill, I'm sorry, people are not learning enough from a demo. Skill reinforcement, I mean, you have multiple classes. Now you are, you're getting support to see that you've done better than the last time. Now your mise en place isn't, a mess. You feel more ready to take this and do it at home, because you don't imagine that if you go do this at home, it's going to be, too much to clean up. You're learning to clean it. You go, there's so many things to learn, right?
Yeah.
Also, home environment, as I mentioned, transferring the experience to home, setting it up so that people want to do this at home, no matter the age. Collaboration, just doing it with other people, making it social. Peer support, feeling like, oh my God, we're all having to do this right now. Like that sense they are different, right? Peer support, you can have someone else, if you're 3 years old, another 3-year-old, they're tasting the food. You're not sure you want to do it, but they didn't die. So maybe I'm safe to put that in my mouth. And then there's, let's see, we talked about, I think that's most of it. I don't know if I got to all 10, but I'm close.
Yeah.
Oh, recipe concept. We don't work in hard lockdown recipes. We work in concepts so that you'll make a recipe and it will have your ingredients and measurements and all that. But then we tell you in different seasons, you can use this, you can use that, and give people more license to explore. And because if you happen to make a recipe that day with eggplant and a few other things, guess what? Maybe 30% of the people in that class don't like eggplant. They're not won over. But if you tell them go home and make it with red peppers, and they love red peppers and other things, then they're fine with it. And so people, that's the other thing. You have so little, it's so expensive to do this work. I don't mean what we're charging. I mean, just to organize programs like this, because there's food and everything, any education is expensive, right?
Sure.
You don't want to limit people. It makes me crazy when I see a class and all they do is work on a zucchini. And you're like, oh my God, you took up an entire class. And if everyone doesn't like it, no. So we do one pot recipes, many, enough ingredients, different recipes, more ingredients, some less. But the concept is they're always flexible. You go home and you do it the way you like.
Yeah. So I read that 1 in 3 adults have not ever been educated in nutrition. So when you think about that, why is that? And what do you see as the barriers to making nutrition education more streamlined and accessible to people?
Well, I think the reason why not enough people have, apart from, maybe access to that education, people hear the word nutrition and they fear being shamed for their food
Mm,
choices or feeling like they already know they don't like the things that are good for them. So they don't want to
mhm.
be, you know, they don't want to be trapped in an educational environment where they're going to be pushed to do that. Right.
Yeah.
So, and that's personal interior barriers, right?
Mhm,
Then there's the external barriers of where they have access to classes like that.
mhm,
And there's not enough of that. And, we have a program that, I'll give you an example. We have a program that we do called Deliciously Healthy, and it's for patients with chronic disease,
mhm.
but it can be opened up. Not just we do it with New York City Health and Hospitals, and it's online, but it's not limited to just those. It's very open.
Mhm.
We get it out there to a lot of people, but a lot of people are not taking advantage of it. And one of the reasons is actually what brings us back to like the clinical setting. So even if we have 4 or 5 hospitals that are like feeding patients to this, there aren't enough people actually, there are more people sign up than actually come. But
Mhm.
I know that one of the reasons why it's because the electronic medical record of whoever the endocrinologist is or the cardiologist that's saying, yeah, this is a patient you should, have in your class. They're not giving them a treatment like referral in the same way. There's not slots in the electronic medical record that says this is your treatment. This you should do this. Just
It's
like
not
you get
prescribed.
Yes, just like you get an order to go for a test
Mhm.
or for whatever prescription, right?
Yep.
That's what we need. And it's
Right.
not happening. And it's very frustrating. There's that. And then a lot of the adults, they're fearful of, the things that I mentioned. And so there's many reasons.
Mhm. Mhm. So when we're talking about nutrition education in the community, I know that you're talking about, children probably all the way up through elderly. Is that fair to say?
Yes, absolutely.
Yes. And you're doing it through food and cooking and incorporating nutrition lessons as well at the same time. So
Always.
walk us through like a typical child-based food education program that you might have in the community.
Sure. Um, we were the recipients of a very big award from Robin Hood for our
Mhm.
early childhood program called Nibble with Willow. So that's for like 3K,
Uh-huh.
4K. The program had started out about a decade ago in WIC centers. And
Mhm.
then, the ability to do that, more or less the funding was not sustainable. So we did a regroup for childcare, which I love more because, WIC parents, they only come to the WIC center for education 3 or 4 times a year.
Mhm.
Where in a preschool setting, you can have children are there every day and you can
Yeah.
reinforce. So this program reinforces weekly. And since we're on video, I could introduce you to it's called Nibble with Willow, and this is Willow.
Oh, cute. Little
She's a
bunny
bunny.
rabbit.
She's a
Yeah.
bunny, and what she does, well, she says she wants you to know that she grows food in her garden with children. That's how she plays with kids. She grows food in her garden.
Oh, cute.
So Willow is many things. She is a character that comes to your school through your teacher, right? We've trained teachers, and she lives there's a garden apron that teachers wear,
Mhm.
and there's a burrow pocket at the bottom, though you have to wake up Willow and she comes out. And then in the pockets of the apron, there's felt pieces that relate to the season, that relate to what's growing in the different seasons, what's vegetables are growing, and there's posters. And the children first look at the felt pieces. They guess what Willow is going to share with them that day related to the season. And then they take out magnifying glasses and look at the real food and look at the seeds in it. Then
Mhm.
they move to a table and they make a very simple preparation. And then the last thing that they do, which is so effective, is before anyone tastes anything, they say, Willow's back, and they say, 1, 2, 3, nibble. And that is just an invitation. Take a tiny little bunny bite. You're not telling one, forcing. I'm sure you know you're familiar with the Ellen Satter's division of responsibility. So you're not forcing anyone to eat anything, but we're also repeating. So if somebody doesn't like it that first day, we're going to do the same thing again next week, and we're going to change it just a little bit. So they keep seeing these things that were started out unfamiliar, now more familiar. And from month to month, Jill, we change, some months, it's like root vegetables. So that includes beets, and we're grading them. And that seems a little strange to some people. But then we have, March, an example, which such common things, cherry tomatoes and cucumbers. So we alternate, but there's never anything exotic, right?
Yeah.
But it's so successful. We have, we just published a new research article in Journal of Nutrition Education and Behavior. So, what it looks like is a lot of igniting excitement, no matter if it's adult, an elderly person, or, a child, igniting curiosity and experiencing hands-on something that you might take for granted or you're not that interested in, seeing what's interesting about it, exploring it in a way that's a food preparation that is not just, like the alchemy of I made this, but we also emphasize deliciousness. It has to be really delicious. If it's not really delicious, then, you're not going to have that same excitement.
Yeah.
So to me, those are the elements.
Yeah. Well explained. So, when we talk about education in the communities and impacting overall community health, what have you learned over the years of, providing this in education, these systems, these tangible educational experiences? What have you learned in terms of how it has impacted the community's health? Are you measuring that with? Yes, you are.
Well,
of course,
to the extent that we can, right? Because,
yes.
Like for our adolescent work, and we have a program called Teen Battle Chef. When we were, beginning to penetrate that in New York City schools, when I was doing research, I wasn't researching what happened in one school. I was researching what happened in 15 schools, right?
Yeah.
And what was exciting is that not only, because another thing that, you asked me about the secrets, and I think it also answers the other question you just asked right now about what are the impacts. What makes, for us, if it's a child education program, what makes us a little different and I think also effective is that we're combining the nutrition education with child development. So if it's the younger children, everything I described to you about Nibble with Willow, you could see all the pieces of early childhood development, right? It was designed with a Waldorf early childhood educator.
Yes.
When you look at, go to the other extreme of the adolescents, we get funding from youth developers, people who are, foundations for youth development, because they see we include public speaking. Their self-esteem is changing. So all of those things are possible to move the needle on, and it becomes more interesting to the schools if they're going to get an academic outcome as well, because most schools don't have, the money or the time and energy to focus on just diet. I mean, they think it's important more and more, but they see it as a nice to have.
Do you find that incorporating STEM or STEAM aspects helps schools adopt some of these programs?
Well, the problem I have with that, because I think that we do that to a certain extent, but usually focus for that is usually in school time. And so usually what happens is that because it's in school time and you know how long school periods are, you can't really make a full recipe.
I see.
So for preschool, you can, right? Because it's like a 20-minute session. For high school, what you can do if you want, to answer that question, what we do often is work with the school, and they'll start the program for like a health credit, the last period, and they'll extend it into
after school.
Because you need about 90 minutes to make a recipe properly and all of that.
Yeah.
So, yeah.
That's very cool. Well, and so your programs are not on school time. You're not trying to be part of the school education. You're doing external. That's its own entity. Your programs
preschool
are
it is. Preschool it is.
preschool. It
Yeah,
is.
but elementary and not so much. Like I said, sometimes we will do a shorter version of our elementary Look Who's Cooking program that can be finished in 50 minutes. But it's really hard because they're still gonna, for our programs anyway, it's not a tasting. They're actually gonna make something, even though it's gonna be very different if it's gonna be done in 50 minutes. So we might use a microwave, we might use a little mini oven or something. But the problem is that that needs to be cleaned up and out of there for the next class that's coming in or for the next thing that they're doing. And, you know, if we're licensing and training this, then not enough schools have that staff that can do that transition. And I don't have enough interns that I can just send them to every, so it's a little bit of a challenge for us because, so I say, well, there's, and I think this also answers your other question about, what can be achieved with nutrition education, community health. We're part of the Food Ed Hub, right, at Teachers College and the Tisch Center. And so all of us that are, multiple organizations, so many of them are elementary. And so all together, we all of us try to reach as many children in many ages as possible, but also we're mapping around the city to see where are there the gaps and supporting schools to be able to have that. So I think that kind of helps. And if so many of the organizations that are working in elementary schools are doing it in that 50-minute period, well, they may not be able to make full recipes like we would like to, but at least they're getting something, and they're usually getting something that's a bit hands-on, right? And there is some palate development and all of that. But, it's hard.
Yeah. Let's shift a little bit because today, in my world, there's just, I'm online a lot and there's just a lot of conversation about ultra-processed foods being toxic and whole foods are superfoods. And there's just all this polarization around food. Are you seeing that sort of come up in the programs from maybe the parents of children? Is that something that you're having to tackle today? Because the noise, the noise about food is getting stronger and louder.
You may be surprised what I'm going to say, but actually what I've experienced recently in the last 4 or 5 years is that the level of knowledge about food and what's good for you has grown so much in the population of all ages. Children know what's really supposed to be good for you. Parents know. Maybe it's true that they might have, like I was saying earlier, a little bit of an attitude about, even though these foods are supposed to be good for you, they're not sure they want to eat them. But what I've found that it's really benefited the increase in knowledge of being able to distinguish what's a good food choice has enhanced our ability to come in with a program that is very engaging, right? And you get a little bit less resistance because they already know, especially kids. People think that children aren't, that. I think people underestimate how sharp children are, is what I want to say, because they get it, they know. And so if you're going to be in an environment and you make it entertaining and interesting enough, they're not going to be resistant. I mean, they're not going to be as resistant, say. And I think the fact that there's already a lens of knowledge that they, a filter that they have about what really they should be doing, they're a little bit curious. Could they actually start to like those things? So I think the shift in knowledge has helped. And yes, there's a bit of polarization, but I don't find it very much impeding our success.
That's good.
Thank goodness.
Yeah, no, that's awesome. When you think about nutrition education, just in general, the nutrition education we have in schools, the nutrition education on online platforms, you're doing your thing, I do my thing.
Yep.
Governmental agencies that are also trying to provide nutrition education. What's your wish list in terms of improvements around, this just general sort of umbrella of nutrition education for children especially?
So I am convinced that like two big things, right? If it was on my wish list, I have two really big buckets. One is that we really, really, really need to invest in nutrition education with really young children for two reasons. One, because obviously you're impacting their formative, their palate, all of that. But also because when parents have really young children, they are very involved, right? They're not very involved when they're, 9 or 10. They're not similarly as deeply involved at 9 and 10 or adolescent. But with really young children, they need help with everything.
Yes.
So you're supporting them, and think about all the immigrant parents we have, that the food is different here and they're really not sure what to do with this food landscape. Well, if you give equity in the education to everybody and you don't tell them they have to eat asparagus, it's not about what they have to eat. You're just showing them foods that are good for your family and ways to eat them, and then go and adapt the way you want. But you didn't say put potato chips in there, right?
Yes.
You also didn't tell them never to eat a potato chip either, right?
Right. Yes.
Focus the education on the things you want them to do.
Mm-hmm.
So I really think that early childhood is very important, because that's when the family habits start, and you can influence the adults as well. The other big bucket that I have is what I was talking a little bit earlier about what's happening in clinical settings. I'm a part of the leadership of the Teaching Kitchen Collaborative. Most of the members there are some nonprofits like us, but most of the members are hospitals and all kinds of institutions that are trying to, think about this in terms of treatment, right? For chronic diseases and all of it, and prevention.
Food as medicine.
Yes.
Yes.
So I explained my own experience with the frustration trying to get the program that we're offering as a treatment prescription through the EMR, electronic medical record. And you would not believe how difficult it is it's not that they think it's a bad idea, but somebody has to actually take the time to work with those slots and program it and everything. And that's not anybody's job, because once these systems are set up in an environment like that,
yeah,
they'd have to call somebody.
Yeah, it's a technical thing.
And if they called somebody, they have to babysit that it's happening. And that's taking time from, clinicians have no time.
Yeah.
And so it's, I feel like we need some kind of, national, like training program that you can spend 20 minutes and program your, and the codes, right? Because you have to have the codes in there for different things.
Yeah.
So I don't know how, I have colleagues in the TKC, that Teaching Kitchen Collaborative, that, are helping, work with insurance companies and find some codes and establish some codes, and the codes get shared. But they still don't always get it into the EMR. And without, think about a patient. Patient says, doctor says, here's your prescription, do this. They're like, oh, okay, I have to call them and find out when the classes is. Very different than when they get a flyer and say, oh, you might want to take these cooking classes. And they're like what I told you, like, oh, no, I don't want to eat that food.
Yeah.
They're going to make me feel embarrassed. So this is what I eat,
Yeah. Yeah.
But if they just get a prescription.
Right. And what I hear you saying is you wish it were more formalized and part of the treatment plan.
Treatment process.
Prescriptive nutrition.
Totally. Because then it would normalize it. It would make them feel like everybody that has my condition, this is what they're supposed to do, just like taking the medicine, right?
Yeah, yeah. Which brings me, and I didn't really think about this, but thinking about food as medicine, that whole movement. And what are your thoughts about that?
I think it's super important, but I also think that and hope that people will approach it in the way that, we did that research about what actually drives behavior change, because talking at patients and telling them much more than they ever want to know about their disease and how their body works, is not going to do it. And too many of the programs that I've seen, do a demo here or there. And a demo is not the same as hands-on, or sometimes they do hands-on classes, but there's 8 sessions and there's like 3 of those 8 are hands-on. I don't think that's enough either. I found you need like 5 or 6 classes of having your hands in food
Mm-hmm.
to start to feel like you're not going to resist doing this when you're not with the teacher. Do you know what I'm saying?
Yeah.
You feel confident that it's not to be too big of a mess, that you're not going to, I don't think people worry about cutting their fingers, most adults, but they worry about it being messy. They worry about it being hard. But if they've worked with the instructor and they've learned one huge thing is knife skills
Mm-hmm.
will change people's idea of cooking with vegetables, right?
Mm-hmm. Mm-hmm.
Now it's easier. They're using, I always remind people, you know, having been in food industry before, don't think that, you know, food processors, what happens in restaurants. So when you're in a restaurant and you're in the back, you know, garde manger, you're making all the food, the raw food. Everyone has a knife. Everything is cut up. Nothing goes into the food processor. Like, no,
Yeah.
they're losing the juices and everything. No one would put onions in there. No. So people are surprised. They, you know, like everybody has a knife. I said, how do you think they could stand in the kitchen and chop for 8 hours? They have to have a
Good
way of
skills.
doing it that's
Yeah.
ergonomic, right? And is
Yeah.
not going to give them carpal tunnel or
That's
something.
right.
You know?
Yeah.
But
Yeah.
people don't think about that. It's like once you know how to cut, so that's why we really emphasize that.
Mm.
Then it's like, oh, recipe has 3 or 4 vegetables. But if people struggle with a knife, you give them recipes of 3 or 4 vegetables and they saw a chef demo it. No, that's
No.
not giving them the skill that they need to apply this, right?
Yeah. Yeah. As we wrap up this conversation, what do you wish parents knew about nutrition education?
That's easy. That it can be fun and delicious. I think that's all they need to know.
What would you say to motivate a parent to pursue nutrition education, food education for their kids?
That you can change your family life to spend more enjoyable time as a family around the table, knowing that you didn't, you know, always take the shortcut to the prepared thing or, you know, this is what this person likes. This is, you know, that you could have home prepared meals and that you don't have to do it by yourself, right?
Mm.
Your children can help you. If they're older, they can have nights when they're the ones who are the cooks. My kids started cooking for me when I was in their schools. And I would say the oldest was definitely not in high school yet, maybe 12 or so. And I would come home cooking with, you know, almost 100 other people's or maybe more than 100 other people's children, exhausted.
Sure.
And I'd be like, I would feel terrible. I'm like, oh my God, you guys, I can barely stand up. What are we going to do tonight? Are we going to cook? Or, you know, should I go out and get something? And they'd be like, no, we're cooking. And I'd be like, okay, then we're going to come up with something that's easy and you're going to do most of the work. And they would.
That's an awesome story. I raised my kids cooking too. And I wish I had more time to have devoted to that. Quite honestly, I started working when my youngest was in kindergarten and working out of the house. And yeah, I mean, we still cooked, but the patience to let them, and I had 4, so the patience to have like a little army in the kitchen. But they all love food. They all love to cook. And I think at the end of the day, that's the goal we're striving for is helping our kids learn about food in positive ways, have hands-on experiences with them, enjoy learning the skill of cooking and preparing food. So they carry it with them forward.
Exactly. And didn't you also notice that by doing that and sharing the meal together, the connectivity as a family,
100%.
and when they get into that crazy adolescent stage and they want to be in their room and everything,
Yeah.
they wouldn't think of eating their food there. Like they know they
No.
come out and sit at the table.
Yeah.
And that facilitates conversation that it's hard to have other times, right?
Yeah, I do. I always tell the families that I work with that, you know, family meals coming together, that's your only touch point.
That
It
is.
really is your only touch point as a whole unit. And it is so incredibly important for children's emotional well-being
Yes.
and the culture of the family, the connectivity, as you said, and the culture of the family. So I'm with you. I'm with you. I appreciate the work that you do. How can
you.
listeners who are listening to this episode get in touch with you or find more about your work?
Oh, sure. they can go to FamilyCookProductions.org or just email me, Lynn, Lynn, at FamilyCookProductions.com.
Okay. Well, Lynn, thank you so much for coming
Thank
on the
you.
show and all the work that you do to better children's health and their knowledge of food and even older people too. So I really appreciate that.
Thanks so much, Jill. It was a pleasure to be here with you. And, I'm so passionate about this. It's just, I love to talk about it. So thank you.
That's amazing. Thanks for tuning in, friends. I hope you enjoyed this episode with FamilyCook Productions founder Lynn Fredericks. I'm going to link up her contact information in the show notes so you can contact or be in touch with her if you are interested in any of these programs for your own schools, your children's schools, or what have you. And don't forget thenourished.child.com has your nutrition articles and education materials to help you raise and nourish and nurture a healthy and happy child. And speaking of that child, don't forget to give that kid in your life a loving squeeze today. Bye for now.
Thanks for listening to the Nourished Child Podcast, where the #1 goal is to help you grow a nourished child inside and out.